So today I wanted to talk a bit more about the mind-body connection and where that comes from. I think the work that I've done with SERPA comes from its foundations with Dr. John Sarno, who was a rehabilitation physician in New York. And in the 1970s, he noticed that he was treating a huge number of patients with chronic pain, and yet they didn't seem to respond in the same way and they weren't getting better. And what he noticed also was that alongside their pain, they tended to have other stress illnesses. So they tended to have other conditions that had a stress component to them. So for instance, headaches or irritable bowel or reflux. And so he started to see the correlation between the mind and the body, in the sense that he was saying, well, if stress is causing these symptoms, why can stress not be causing pain? And initially, his work was really dissed. I mean, he was almost outcasted by his peers for starting to suggest actually that these patients didn't need medication and didn't need any sort of physical therapy, and that there was an emotional component. And but he held his guns and he kept going, and he essentially now actually the whole of our real, the latest understanding of pain recovery very much stems from the work that he did. Curable, the Curable Health app, they certainly base all their work on, on Sarno's early work. And as I say, Georgie Oldfield from SERPA brought the approach to the UK, and that's where I'm trained, and Louise, my colleague, is trained through SERPA, the Stress Illness Recovery Practitioners Association. And it's a difficult one, I think, because I think there's so many names for it, and stress illness makes sense in some respects, but it also then again sometimes feels like it slightly dismisses it or disses it in a little way. But I think the difficulty is that there seems to be so many names for chronic pain conditions, and none of them are really, there's not one thing. And as the the research goes on and people add new things, and or they call it different things, because that's how they've come at it. And I think actually we're probably all talking about the same thing, and I wish it had sort of one name. So for instance, one of the most common ones for a chronic pain condition is fibromyalgia. We've also got now, people are calling it primary chronic pain. It has just been called chronic pain. It can be called functional neurological disorder, which is does have more neurological elements in it, in the sense that people often are experiencing weakness, tingling, can experience almost seizure type behavior, and a lot more deficit in function. But as then often it's due to this nervous system that has had an adaptation a certain way. We talk about often neuroplastic pain or neural pathway pain, which is about the fact that the pain is coming from the neural pathways. There's a neural link. It might be called mind-body disorder, psychophysiological disorder, and Sarno actually called it TMS, tension myoneural syndrome. And this is quite a good name for it, because essentially what ends up happening in the body when we have these conditions is tension. So that's why we experience it in the muscles in our body, and it feels like it's a muscular or a joint problem. But it's tension within the muscles, so tension myoneural, but it comes from that neural basis, so those neural pathways, because the nervous system has got into a pattern of learnt pain. So the Neuro-Orthopedic Institute talk very much about this as a learnt pathway, but don't necessarily talk quite so much about the emotion and stress of it. Talk more about the stress, but not so much of the emotion. Whereas with this approach, the change of pain approach, we're looking at all of that. Now, sometimes we may have dealt with the emotion and we may have dealt with the situation, but actually our bodies have just still got stuck in that pattern of pain. And there are various exercises that we can do to start to change that. The recent Boulder study in Colorado showed that doing pain reprocessing therapy, which looks at these emotional components and to help reprogram the pain, they had a 66% success rate with the patients that had the pain reprocessing therapy compared to normal treatment that they would receive or sham treatment. And so what's really lovely, and it's a shame Dr. Sana is not here to see it, but it is really changing, and we can now see the evidence for these approaches to the mind-body pain. I think we're still stuck, though, in that slight place of feeling like it is psychological and therefore it's like a choice to have this pain, and that is so not true. I think trauma, when trauma occurs to the body, is the trauma is the event, but actually how the body then responds is very often not in our control. And I think we then can process it and we can do different things and address it in different ways afterwards, but actually in the moment it's happened. And I think what we're not good at in medicine in this country particularly is actually getting people to talk about their trauma and the stress of the events that happened as they happened, so that they don't then become ingrained. We so often talk to people about their pain, and when they talk about the onset, whether that's 5, 10, 15, 20 years ago, they're still experiencing the trauma of that event and the stress of that event, and they've got stuck in that place, and their nervous system has got stuck in that place, and their muscles have got stuck in that place, and it's almost like their body has got stuck in a fight-flight pattern that is just then persistent. And actually we can have, you know, really good therapy and we can have really good physical therapy, but until we start to put the mind aspect and the body aspect together, it's really, really hard to make a change in the symptoms. The other thing is too, is we have to continue to practice it. It's a bit like growing a small plant from seed. What you've got to do is, you know, you've got to have a scrabble around in the ground to clear the weeds to start with. And then when you plant the seed, you have got to nurture it. So you've got to keep watering it. And we often do that early in our process. We keep watering it, we keep doing our techniques. And then actually we get to a point where we feel a little bit better and we stop paying it quite so much attention. And certainly in my own experience with my own chronic pain, I find that I actually still need to do the techniques, because life keeps happening and we can't get away from it. And if we could live stress-free on a beach somewhere, that'd be amazing, but that doesn't, you know, isn't a reality. And so essentially we do need to sometimes, even when we've addressed the stress or the emotional or the trauma, we do actually need to keep nurturing our nervous systems, keep nurturing that mind-body connection.